Hello and welcome. Today, we're diving deep into a lesser-known but important topic in male reproductive health: Leydig cell hyperplasia. We'll explore what this condition is, what causes it, how it's diagnosed, and what treatment options are available. So, let's get started. The exact cause of Leydig cell hyperplasia isn't always clear, but it's generally believed to arise from prolonged stimulation of the Leydig cells. This stimulation often stems from elevated levels of luteinizing hormone, or LH, secreted by the pituitary gland, is a key regulator of testosterone production in Leydig cells. In some instances, the hyperplasia can be idiopathic, meaning it occurs spontaneously without an identifiable cause. Certain genetic predispositions or environmental factors are also suspected to play a role in some cases, though research in this area is still ongoing. Leydig cell hyperplasia fundamentally involves an increase in the number of Leydig cells within the testes. This overpopulation of cells can lead to an overproduction of testosterone. Elevated testosterone levels then exert a negative feedback effect on the pituitary gland, suppressing the release of LH. However, despite the lower LH levels, the increased Leydig cell mass continues to produce excess testosterone. This hormonal imbalance can disrupt the normal function of the hypothalamic, pituitary, gonadal axis, the intricate system that controls male reproductive hormones. Unfortunately, robust epidemiological data on Leydig cell hyperplasia is somewhat limited. It's considered a relatively uncommon condition, often discovered incidentally during investigations for other reproductive issues. It is important to note that Leydig cell tumors are more common than Leydig cell hyperplasia. While it can occur at various ages, it is more commonly seen in adult men. Understanding the true prevalence requires further research and improved diagnostic methods. The symptoms of Leydig cell hyperplasia vary depending on the age of onset and the severity of the hormonal imbalance. In adult men, common signs can include decreased libido, erectile dysfunction, infertility, and gynecomastia, which is the enlargement of breast tissue. In some cases, men may experience mood changes, acne, or increased muscle mass due to the elevated testosterone. In prepubertal boys, signs of precocious puberty such as accelerated growth, deepening of the voice, and development of pubic hair may be observed. Diagnosing Leydig cell hyperplasia typically involves a combination of physical examination, hormonal blood tests, and imaging studies. A doctor will assess for signs of hormonal imbalance and conduct a thorough medical history. Blood tests will measure levels of testosterone, LSH, and other relevant hormones. Elevated testosterone with suppressed LH levels can raise suspicion. Ultrasound imaging of the tests can help visualize any abnormalities, such as enlarged areas suggestive of hyperplasia. In some instances, a testicular biopsy may be performed to confirm the diagnosis and rule out other conditions, such as Leydig cell tumors. While Leydig cell hyperplasia doesn't neatly fall into distinct like some other diseases, can be categorized based on the extent of cell proliferation, a focal versus diffuse, and whether it's associated with other testicular abnormalities. Additionally, it's important to differentiate it from Leydig cell tumors, which are a separate and potentially cancerous condition. Treatment for Leydig cell hyperplasia depends on the severity of symptoms and the individual's specific goals. If symptoms are mild, a watchful waiting approach might be adopted, with regular monitoring of hormone levels and testicular size. If symptoms are bothersome or affecting fertility, treatment options may include medications to block testosterone production or its effects, such as anti-androgens or aromatase inhibitors. In some cases, surgery to remove the affected tissue may be considered, especially if there is concern about a potential tumor. Fertility treatments may also be necessary for men struggling with infertility. Currently, there are no definitive preventative measures for Leydig cell hyperplasia due to the often unknown etiology. Maintaining a healthy lifestyle, managing hormonal imbalances, and avoiding exposure to environmental factors that may disrupt endocrine function could potentially reduce the risk. However, further research is needed to establish specific preventative strategies. The prognosis for Leydig cell hyperplasia is generally good, especially with appropriate management. Many men can achieve symptom relief and improved hormone balance with medical treatment. Fertility may be restored with targeted interventions. Research continues to explore the underlying mechanisms of Leydig cell growth and to develop more effective and targeted therapies. Newer approaches may involve modulating specific signaling pathways involved in Leydig cell proliferation. Future research may also focus on identifying genetic predispositions and environmental risk factors to enable earlier detection and potentially preventative strategies. Thanks for joining us on this exploration of Leydig cell hyperplasia. We hope this information has been helpful.